let's go on to our next topic, diseases and immunity. In this section, we will mainly talk about diseases, different types of diseases and the immunity that is against these diseases. So what are these diseases? Diseases are abnormal or unhealthy state of your body. It can happen in any part of your body that do not function in a normal way. Diseases show signs and symptoms. There are mainly two types of diseases: non-communicable diseases, that are diseases that are not infectious, that cannot be transferred from one person to another by touching likewise. It cannot be spread from one person to another. In order to have these non-communicable diseases, it will take a long time, and in order to cure also, it will take long time and it progresses very slowly. And the second group is known as communicable diseases. Communicable diseases include infectious diseases, that are diseases that are caused by pathogenic microorganisms. The main character in this is they can be transmitted from one person to another. So first let's look at non-communicable diseases. If you look at this right hand side, you see this picture, it will show the number of deaths in millions in 2019 recorded based on different diseases. You can see the blue color indicates the non-communicable and the green color indicates the communicable. You can see most of the ones are blue color because 74% of all deaths in the world are because of NCDs or non-communicable diseases. Over 80% of these non-communicable diseases belongs to major 4 categories: cardiovascular diseases, cancers. You can see cardiovascular diseases, these two. Then you can see cancer. Then you can see chronic respiratory diseases here. Then diabetes here. And because of diabetes, the kidney diseases also can happen. So you can see both of them here as main 10 reasons. So these NCDs are resulted by a combination of genetic, physiological, environmental and behavioral factors. People at all age groups, regions, countries are affected by NCDs. The first NCD that I am going to talk to you about is cardiovascular diseases. These cardiovascular diseases are diseases of heart and blood vessels. These include coronary heart disease, cerebrovascular disease, rheumatic heart disease. So CVDs are number 1 cause of death worldwide. The 4 out of 5 CVD deaths is due to heart attacks or due to stroke. So how does these cardiovascular diseases happen? The most common reason is the buildup of fatty deposits in the inner wall of their blood vessels. If you have more fatty deposits in your blood, it will get deposited in the vessels. This condition we know as atherosclerosis. If you look at this map, you can see this is the death rate from cardiovascular diseases in 2021. You can see in some countries it's very high, like Egypt, Russia, it's high, the death from cardiovascular diseases. So in Egypt it's 612 people in 10,000, 100,000 people, among 100,000 people die because of the CVDs. If you look at the Thailand, it's in slightly a good condition. It's only 128 people die in 100,000, among 100,000 people. It's slightly better than rest of the world. So what is this atherosclerosis? So how does this happen? So you can see this is a normal artery where there is no blockage to the blood flow. But in persons with atherosclerosis, this is caused up by a buildup of fatty deposits in the arteries. And these deposits are known as plaques, that is made up of fat, cholesterol and calcium. And over time, these fatty deposits become bigger and bigger and bigger, and they slow down the blood flow. And the dead red blood cells can also stuck in there and stops the blood flow, form blood clots easily. So the clots that stop blood flow to the heart, they cause heart attacks. And the clots that stop blood flow to the brain, they cause strokes. So what are the risk factors for these kind of CVDs? One of the main risk factor is age. In addition to that, smoking, high blood pressure and diabetes is the secondary risk factors. So risk factors here you can see I have divided into two sections, modifiable factors and non-modifiable factors. Modifiable factors means if we try and change our habits, we can change these risk factors. But non-modifiable risk factors means we cannot change these factors. It's gender, genetics we cannot change, our ethnicity we cannot change. So these factors also affect CVDs. The next disease that I am going to talk to you about is respiratory diseases. Respiratory diseases are diseases of airways and the other structures of the lung. The most common respiratory diseases that we found are chronic obstructive pulmonary disease and asthma. So respiratory disease is the third leading cause. What is the first leading cause? CVDs. And the second leading cause is stroke. And the third leading cause is respiratory diseases. This usually happens in 90% of the low income countries. Both of these, asthma or chronic obstructive pulmonary disease, they causes reduced airflow to the lungs. If you look at this, you can see this is an airway of a healthy person, healthy lung. And this is a lung with airway of a lung with asthma. You can see main differences. Here you can see the muscles are relaxed, but here you can see the muscles are tightened. And you can see here the airway is not swell, it's normal. But here you can see it's swell. And here you can see this is the main character. The airflow, the diameter is restricted in the diseased person with the disease. So the mucus clogs the airways and the lungs have the difficulty in moving air. These are actual images of the healthy airway and chronic fibrosis airway. You can see this airway is slightly swollen, and this is alveolus that is inside your lungs. You can see in a person with respiratory diseases, they are swell. This is the normal condition. This is the swelled condition where you have the disease. So if you look at this map, this is the death rate caused from chronic respiratory disorders in 2021. This is per 100,000 people. And you can see the highest records are from India and Papua New Guinea. And if you look at Myanmar also, it also has a slightly bigger risk. But if you look at Thailand, it is much better. It's in the second category only. It's much better. It's just 24 people among 100,000 people have died because of the chronic respiratory diseases. So what are the risk factors for these chronic disease, respiratory diseases? The main risk factor is tobacco smoking. In addition to that, these are all changeable behavioral patterns: air pollution, occupational hazards, allergens, low birth rate and poor nutrition, obesity. These are the factors, changeable factors. What are the non-modifiable factors that we cannot change? We cannot change our age. We cannot change whether we have respiratory infections from birth. We cannot change our genetics. So these are non-changeable factors. So let's go into our next main disease, that is cancer. Cancer is a disease in which the abnormal cells in your body divide rapidly, uncontrollably, and then invade the nearby tissues. If you look at this figure, you can see these are normal cells. And you can see there are some 3 abnormal cells among these normal cells. When they start dividing, because all the cells divide, but when abnormal cells starts divides, they divide uncontrollably and rapidly. So there becomes a cancer, in situ cancer. And when these cancer cells are near to blood vessels or near to lymph systems, they can be passed from one place to another through blood or lymph system and can affect any body part. In the world now, there are more than 100 types of cancers, more than 100 types. So cancer is the second leading cause of death globally. And if you look at this is the prevalence of cancers. You can see mainly the developed countries have the highest rate of cancer. So like USA, Canada, Australia, actually Australia reported the highest in the world. And if you look at Thailand, it's at the not very safe, but it's at the second or third group category. If you look at the world, different types of cancers in the world, the highest cancer in the world is lung cancer. But if you categorize it based on men and women, the highest occurrence of cancer in men is the lung cancer. The most probable cause may be tobacco smoking and then prostate cancer. But in women, the highest cause of highest incidence is breast cancer. If you look at the situation in Thailand among men, the highest cancer is liver cancer, and among women, the highest cancer is breast cancer. But if you look at the mortality rate and the incidence rate, not all cancers are very dangerous. Not all cancers can cause death. If you look at this, look at the prostate cancers, even though there is very high incidence, the number of people die from the cancer is less. But if you look at lung cancer, let's see, the incidence is over 1.5 million, but the death is over 1 million. So this is a very serious cancer. Similarly, liver cancer, you can see 500K will get, over 500K will get the cancer and nearly 500K will die. So these cancers are dangerous. They don't have the same mortality rate. Some cancers can be treated and be cured. If you look at the condition in Thailand, liver cancer has the highest mortality. You can see the incidence and mortality is almost similar. And the second most dangerous one is the lung cancer. But second most highly reported one is the breast cancer. Highly severe one is the lung cancer. So what are the risk factors for cancer? It's also tobacco use, the changeable factors, tobacco use, alcohol consumption, your diet, your physical inactivity, the exposure to the sun, obesity, those kind of things, hormone replacement therapies. What are the non-modifiable factors? Age, sex, family history, genetics, those kind of things are non-modifiable factors. The next disease that we are going to talk today is diabetes mellitus. Diabetes is also an NCD. In this disorder, people with disorder cannot control their insulin amount. They cannot sometimes produce insulin, or sometimes they cannot control the insulin. So let's say if in a healthy person, the pancreas usually produces insulin, and inside the blood it will release into the blood, and there are glucose in your blood, and glucose is important to produce energy inside the cell. So, this glucose need to enter into the cell. So, this entering that channel is opened by insulin. Insulin is actually the key to that channel. If you consider that channel as a door, insulin is the key. So, there are two types of diabetes, type 1 diabetes and type 2 diabetes. In type 1 diabetes patients, they cannot produce this insulin. Their body cannot produce. Then what happens? The glucose will not go into the cells to be used. They will be available in the cell, in the blood, and the blood glucose level will go high. In type 2 ones, they can produce insulin, but they cannot control it. So, still they cannot open it properly, the channel. So, more than 95% of the diabetic cases, they are type 2 diabetes. If you look at this, you can see the prevalence of diabetes in 2021. You can see the highest rate occurred in Pakistan, where more than 30.8% of the people in the country have diabetes. And the least, and you can see in Thailand. Thailand is around here, where you have 9.7% of the people in the population have diabetes. So, what are the risk factors for diabetes? One of the main risk factors is the obesity, physical inactivity, blood pressure, unhealthy diet, high consumption of sugary drinks. These are all changeable factors. What are the non-changeable factors? Genetics, your age, we cannot change those things, and they can affect your disease. So, this is one group of diseases, NCDs. Now, let us move on to communicable diseases or CDs. Communicable diseases, also known as infectious diseases. These are caused by pathogenic organisms like viruses, bacteria, fungi, and protozoa. The main characteristics of these diseases is they can be transmitted they can be spread or transmitted. So, how does the CD spread? One is from human to human. It can be either by direct contact. So, if you shake hand, if you touch someone, you can get the disease by body fluids. Or it can be indirectly by if you sneeze, if you cough, and with air droplets, the pathogens can go outside. And the second way is from environmental sources. If you eat contaminated food, contaminated water, you can get sick. Another way is from animal to human. There are some diseases that are spread from animal to human. These kind of diseases known as zoonotic diseases. That are diseases that spread between animals and also between animals and humans. So, before we talk about the diseases, let us be familiar with this term, incubation period. Incubation period is a time between the exposure of a pathogen and the appearance of the first symptom. So, if we take this incubation period depends on the disease or the pathogen that is causing the disease. So, here if a virus gets infected, after 7 days it will show the first symptom. This is just an example. So, what is known as the incubation period? Time of occurrence to the time of appearance of first symptom. So, the incubation period here is 7 days. So, in this case, what is the incubation period? It is obviously 2 days. So, let us move on to each of these diseases. One of the main CDs include respiratory infections like the flu. It is very famous in Thailand, the flu season. The flu is usually caused by an influenza virus. There are different types of influenza viruses that can be spreads or infect different categories of people, or different humans, men, different categories of organisms. The flu can be transmitted from animal to another, one animal to another, and also from human to animal. Flu viruses that transfer from birds and pigs are very dangerous. Have you heard of avian flu or swine flu? These are very dangerous flus that has caused many deaths in the past among people. So how you get this flu? You can get flu throughout the year, but you are at the most risk during the flu season. Flu season is different in every country. So do you know the flu season in Thailand? It's from June to October. It is the time when the flu easily spreads. This is mainly due to the environmental conditions. So how does it spread? If an infected person coughs or sneezes, the droplets that is passed in here carries the virus and enter another person through the nose, mouth, or both. And then these viruses travel to the lungs and multiplies inside the lungs. And then the infected lungs release these viruses. These viruses then again infect another person when we sneeze or when we cough. So you can see these are some of the symptoms you can see when you get the flu. So how can we protect against this one? You can always cover your mouth or cover your mouth when you cough or sneeze. Not like this. Why? Because if you do like this and touch another surface, you will contaminate that space. But if you do this, it will not affect others. And if you are sick, you can stay at home. You can clean or disinfect the surfaces. And mostly, you can get the flu shot, that is the vaccine. Now, it's very famous in Thailand. So, if you think you are at risk, you should get the flu vaccine. The next respiratory infection is tuberculosis. This is caused by a bacteria known as Mycobacterium tuberculosis. It mainly affects the lungs. TB also passes through air. And sometimes it takes a decade, that means 10 years to develop the disease. But the good thing about this disease is it can be treated with antibiotic because it's caused by bacteria. It can be treated with antibiotics. And TB is one of the top 10 causes of the death worldwide. And in 2022, an estimated 1.3 million people died of TB. And this is the lowest record. So you can see if the lowest record is 1.3 million, what it have been before. So if you look at this map, you can see this is the tuberculosis cases in 2022. You can see the highest record is from India. And if you look at Thailand, it's around 111,000 cases of tuberculosis in India. These are cases. What about the death rate? So the death rate is mostly high in African region, and in Thailand it's around 19 people per 100,000. It's a bit low. But this disease is becoming dangerous in the Asian region mainly because we have drug-resistant bacteria. Drug-resistant bacteria means the bacteria cannot be killed by antibiotics, and this makes the disease very strong. And the highest number recorded from the drug-resistant tuberculosis recorded from India. And you can see it keeps increasing. You can see here the normal tuberculosis is at decline. But if you see the drug-resistant tuberculosis cases, it keep increasing, it's not declining. So this is become a serious issue. The next disease that we are going to talk about, the communicable disease, is malaria. Malaria is caused by the parasite Plasmodium. So malaria is not spread from human to human. Instead, it's a zoonotic disease, means that it passes by bite of an infected Anopheles mosquito. So if a mosquito bite a person with malaria and then goes to another person and bite again, the pathogen, Plasmodium pathogen, can carry from one person to the healthy person through the bacteria, through the mosquito. So this is one of the diseases that have been eradicated in most part of the world. The incidence of malaria in 2021, you can see most countries does not have any incidence of malaria. But still there are very less incidence of malaria in South American region and in the Asian region. But in African region still there are many cases of malaria. So why? In some parts of the world like here, USA, Canada, Russia, Australia, there is no record of malaria. It is because the widespread use of insecticides to attack the mosquitoes. And mosquitoes usually breed in swamps. So if we change the swamp lands into agricultural lands or the industrial lands, they will restrict the breeding sites for these mosquitoes. And another major thing is the availability of treatment. These are, if you see the most of the countries that eradicated this disease, they are very well developed countries where everyone has the access to health care easily. So there are anti-malarial drugs and vaccines were developed for the malaria control. But similar to tuberculosis, malaria also, you can see anti-malarial, the drug resistant malaria is occurring. This is mainly evident in the greater Mekong sub-region in the world. So it's mainly between the Myanmar and the Thailand border and Thailand and Cambodia border. There is a significant threat to malaria control. Another communicable disease is dengue. Dengue is caused by a virus, and most people usually overcome the virus in few days, but some people it becomes very serious and even kill that person. Similarly, dengue is also not a disease that spread from one human to another. It's also spread as a zoonotic disease through the bites of an infected Aedes aegypti mosquito. The incubation period for dengue is around 4 to 10 days. You can see these are some of the symptoms, and this is how the dengue spreads. So the mosquito bite an infected person and it carries the virus and then infect a healthy person. So this is how it spreads. So this is usually highly occurred in this region. The occurrence is very high in this region. So why is dengue spreading so fast? It's because of the main reason is air travel, increase of air travel in the world. For example, if we take an example, a person flies from Australia to India for a holiday for 7 days. And let's say in the day 5, it get bites from a mosquito, the Aedes aegypti mosquito, and got the infected the virus. So what is the incubation time? What is the time it starts to develop a disease? 4 days. But the person get the bite on day 5. So he will not show any symptoms even on day 7 when he flies back to Australia. There's no symptoms. But after some days in Australia, he will show the symptoms. And then a mosquito in Australia bites the person and then bites another person in Australia, then the disease is traveled to Australia. So likewise, the dengue is spreading very fast. Another communicable diseases that communicable disease that you are very familiar with is COVID-19. COVID-19 is also caused by a novel coronavirus called SARS-CoV-2 that started in Wuhan, China in 2019. In 2020, its seriousness is so high, in 2020 it is declared as a pandemic. It spreads through air, and the incubation period for this disease is typically 2 to 14 days with an average of 5 days. I'm not going to talk more about COVID-19 as most of you are very familiar with COVID-19. So what are the treatments available now for COVID-19? There are repurposed drugs, there are immunoglobulin treatments, monoclonal treatments, and there are different vaccines produced against COVID-19 virus. So these are different treatment patterns. The next communicable disease category that we are talking about is sexually transmitted infections. These infections are transmitted from person to person, mostly through sexual contact. And it also can be spreaded from infected blood or infected tissues. If you are in contact with infected blood or infected tissues or body fluids, you can get the disease. Not only that, a mother can pass the disease, STIs, to the fetus inside mother's tummy during pregnancy and at the childbirth. There are around 30 pathogens that cause these STIs. If you see, there are bacteria that cause chlamydia, gonorrhea and syphilis. There are viruses that cause HIV, human papillomavirus, hepatitis, and there are sometimes parasites that cause the disease like trichomonas. So these are mainly these pathogens spread through sexual contact. And every day more than 1 million people get STDs. And most of these STDs are curable. Why STIs are very important? Because if you get an STI, you will be at high risk for getting HIV. It's 3 times higher than a normal person. It can result in dead children being born. It can result in infertility, even death. So how can we protect ourselves? We can have safe sex practices. We can get vaccinated. There are vaccines. For example, human papillomavirus, there are vaccines. And for many STIs, there are vaccines developed. There are treatments available. So if one partner get STI and get treated, both partners need to get treated. Only one partner getting treatment is not enough in STI. The next category that we are going to talk about is the hemorrhagic fevers. Hemorrhagic fevers are fevers mainly caused by viruses like Lassa fever, Rift Valley fever, Ebola, you may be heard of, yellow virus. These are all zoonotic diseases. Many organs are affected by these diseases, and main character of these hemorrhagic fevers are your blood vessels get destroyed and you will start bleeding. So why the hemorrhagic fevers are so dangerous? Because these the agents, the viruses that cause these diseases are used as bioweapons, and most of these diseases have been weaponized now, and they are commonly found in trophics. The mortality rate of the hemorrhagic fever depending on the agent, but it can go up to 90%. So it's very dangerous. So Ebola is the best example of the hemorrhagic fever. It's a very rare but life-threatening illness, specifically found in different parts in Africa first. It is caused by several species of Ebola virus. The incubation period is usually 2 to 21 days, but the death rate is up to 90%. It's very high. First time it occurred in 1976, and then the largest Ebola outbreak happens in 2014 to 2016, where there were more than 28,000 cases and more than 11,000 deaths reported worldwide. So you can see these are some of the symptoms of Ebola disease. There is bleeding. You can see bleeding even when your poo also bleeds. So lot of bleeding. You can see bleeding here. So how does the Ebola transmit? The Ebola viruses naturally exist in bats, but the bats do not show the disease. So the bats spread the disease into other animals. And these other animals can spread the disease to humans. How? Maybe these animals can bite human. Maybe humans hunt these animals and eat. So by this way, animals spread the disease to humans. Once the human get the virus, it can spread to another person by blood or by other body fluids.